Thank you for tuning in. You're watching the Daily Report for December 9th here in Korea. To boost or not to boost? Now, that is among the questions we seek to answer during our panel discussion on vaccinations later on the program. Here first is the global pandemic update with our Kwon So-ah. So, just start us off.
Sunny, there's been a slight drop in COVID-19 infections this Thursday, but the figure did not drop to below 7,000. In fact, 7,102 cases were tallied as of 12 a.m., and that includes 7,082 domestic transmissions and 20 infections from abroad. Now, it's 70 fewer cases from the day before, and it is around 1,800 cases more than last Thursday. And unfortunately, the number of patients that are in severe or critical condition has been steadily going up, reaching another record high at 857. We'll take a look at that in a bit. But here we can see the regional infections. In the capital region, there's been a decrease in the capital's Seoul and Gyeonggi-do province, but an uptick in Incheon. And in the rest of the nation, we're seeing a mix of ups and downs. And now let's move over to the number of patients that are in severe or critical condition. As I mentioned before, that number stands at 857. This is why the government has been stressing that booster shots are important. We are seeing also 57 new fatalities, raising the death total to 4,077. And now on to the booster shots that were administered a day ago. Almost 300,000 people have gotten their additional dose on Wednesday, and we've got around 45,000 people who got their first dose and more than 51,000 who got their second dose. Now, moving over to the international figures, there's been a rise by more than 703,000 new infections and around 8,300 fatalities. Going over to the countries that are severely hit across the nation, across the world, that is South Africa here has reported another soaring figure of more than 19,000 infections reported in the span of a day. And then here we've got France, which has become the next country that has hit the 8 million mark in total infections with over 61,000 new cases, almost the same as in Germany, which is also reporting more than 60,000 cases a day. And those are the general updates that I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for now. Right, health authorities here are working around the clock to fight the dual threat of surging caseloads and Omicron infections. For more, I have Shin Yeon here in the studio with me. Yeon, good to see you back.
Thanks for having me, Sunny.
Right, so I hear Korea has recorded more Omicron cases. Let's start with that.
Right, so Korea added 22 new Omicron cases on Thursday, bringing the total number of infections to 60. And these include 45 domestic cases and also 15 imported cases, most of them detected in arrivals from southern Africa. Now, given the surge in our daily caseloads and the number of those in critical condition, on top of the new Omicron cases, authorities are considering whether they need to execute an emergency plan. This would involve a circuit breaker, which would immediately suspend our gradual easing of restrictions. Though the authorities didn't use this term directly, they did mention that a set of, quote, intensive measures was on the table in light of the latest surge. Some measures discussed as part of the emergency plan included restrictions on operating hours for businesses and gatherings at high-risk venues.
Yeah, beyond national borders then, how are other countries faring amid the presence of Omicron?
Well, the WHO on Wednesday said Omicron has spread to at least 57 countries. In a separate report released on Wednesday, the global health body said South Africa and Botswana accounted for 62% of all Omicron cases as of December 2nd. The UK in particular is seeing quite a surge. Another 131 cases were recorded on Wednesday, bringing the total to 568. The number of Omicron cases appears to be doubling every 2 to 3 days, according to a member of the country's scientific advisory group for emergencies. That's why Prime Minister Boris Johnson has announced tougher restrictions, such as ordering people to work from home and to show proof of vaccinations when visiting crowded venues. Another global concern is that scientists have identified a stealthy version of Omicron that cannot be distinguished from other variants using routine PCR tests. This offshoot of the Omicron variant has been identified in many countries like South Africa, Australia, and Canada. It's been reported that this particular strain can only be detected through genomic testing, and researchers say that there is a chance that this version of Omicron can behave differently, but more studies will be needed before we know more.
Right. Now, even against the grim backdrop, though, there might be a silver lining because, as you mentioned back on Wednesday, I believe, Dr. Anthony Fauci has said that Omicron almost certainly is not as severe as the Delta variant. Are other experts supporting his view?
They are. The WHO appears to be backing this idea, saying that while more research is needed, Omicron does seem to be more contagious yet less severe. Senior WHO official Michael Ryan said in an interview with AFP that preliminary data shows that Omicron does not lead to more severe illnesses compared to other variants like Delta. Director General Tedros Adhanom Ghebreyesus also cited studies from South Africa that found people who contracted the Omicron variant reported much milder symptoms than those infected by the Delta. But the head of the WHO also repeated what other experts have said, that much more research is still needed. He also urged governments to boost their surveillance and closely examine the behavior of the Omicron variant.
All governments should reassess and revise their national plans based on the current situation and their national capacities. Accelerate vaccine coverage in the most at-risk populations in all countries. Scale up surveillance, testing and sequencing, and share samples with the international community, and avoid ineffective and discriminatory travel bans.
Now, while expressing its discontent towards such travel bans, though, the WHO in its weekly epidemiological report did mention that the most of the Omicron cases reported so far were actually travel related.
Right, and so that particular report you just mentioned also showed, I understand, changing trends in the Omicron, in the COVID-19 outbreak, that is, by region.
Right, Sunny. Now, although the daily tallies, just like here in Korea, are not the only thing that matters, there are a number of risk factors. But when it comes to the daily infections, on that front, there is good news for some and also bad news for some others. In the span between November 29th to December 5th, which is the most recent weekly analysis by the WHO, Europe has posted 2.6 million new coronavirus cases, a slight dip in both COVID-19 infections and deaths for the first time since mid-October, after cases had been on an upward trend every week. The report also mentioned that all Omicron patients as of Monday in European Union countries were mild or asymptomatic. Germany and the UK posted the highest caseloads there, while the US had the most new infections in the same span of some 752,000, recording a 30% on-week jump. The African continent saw cases shoot up by 79%, with recent studies showing more than 7 out of 10 cases being linked to the Omicron variant. However, fatalities dropped by 13% from the week before.
Right, and amid the potential risks of Omicron, then, I hear health experts are reiterating calls for vaccinations, right?
Right. The WHO continued to stress the importance of getting vaccinated, even to fight against the Omicron variant. But we only have very limited data as of now, so we need much more research. But we've actually received results from this Wednesday from early lab studies by Pfizer that suggested a third shot might be needed. On Wednesday, Pfizer said 2 doses of its vaccines might not provide enough antibodies against Omicron, whereas a booster jab does. And the drug maker said a 3-shot course of its vaccine was shown to increase neutralizing antibodies by 25 folds compared to 2 doses. But a chief scientist from the WHO warned that quick conclusions should not be drawn from this lab study. The scientist said that it was way too soon to determine if fewer neutralizing antibodies necessarily imply lower vaccine efficacy. And the WHO is set to publish a review of its stance on the efficacy of booster shots against the Omicron variant within a few days.
Right, so we'll have to wait and see for that. All right, and thank you for today. I'll see you back on Friday.
Thank you so much.
Right, meanwhile, on the domestic front, so I believe health officials are hosting a special briefing on vaccinations for the youth as we speak. What has been addressed thus far?
Right, Sunny. So this special briefing is led by the Commissioner of the Korea Disease Control and Prevention Agency, Jung Eun-kyung, and is also attended by education policymakers and medical experts. And they are still amid a Q&A session. Now, what Jung has stressed at the beginning of this briefing is she appealed to the public to cooperate in the vaccination campaign for teenagers aged 12 and to 17. And she strongly recommended this age group to get vaccinated for the following reasons. Now, first off, the risk of infection has been going up recently. In the past 4 weeks, children and teen infections were higher than their adult counterparts. And she compared this phenomenon to Israel as well, which had, of course, a faster vaccination process than we here in Korea. Meanwhile, also the number of teenagers and also children that have more severe symptoms has also increased compared to before. In fact, currently some 17% of youth patients are being hospitalized, and also there are 11 patients in severe or critical condition. She also mentioned that the infection rate has been going down among senior high school students, which have been vaccinated much earlier, and it's also going down among those aged 16 to 17 because the vaccination rate has surpassed 60%. Meanwhile, the vaccination rate for those aged 12 to 15 is much lower, and that's why there's been a rising caseload in that age group. One of the officials, one of the medical experts, meanwhile, also mentioned that there's been another child death reported just today. So that makes Korea have a total of 3 child deaths related to COVID-19. So really the risks have been gotten higher among those teenagers is what these officials are stressing.
Right, and which is why they're stressing on the importance of vaccinations for the youth as well. Now, so back on Wednesday, I understand Seoul's education authorities held a online Q&A session with parents and students that largely centered on the controversy regarding the necessity, that is, of vaccine passes for teenagers. Could you tell us a bit about that?
Right, Sunny. So that controversy is stemming from the government's shift in its stance regarding vaccination for teenagers. And that, of course, due to the changing COVID-19 situation. So Education Minister Yoon-hae, along with 2 medical experts, held an online forum on Wednesday with up to 4,000 live viewers tuning in at once, at one time, that is. Now, questions were taken beforehand as well as during the live meeting. Some civic groups, students and parents have been calling the vaccine policy, which will include teenagers next year, an infringement of freedom. Let's take a listen to some of the students' opinions.
It seemed like those aged 18 and below were given a free choice. I don't understand why less than 2 months later, it was announced that vaccine passes would be required for teenagers starting in February next year.
Vaccine passes won't apply at places of worship, rallies, amusement parks, and department stores. I wonder why these exceptions are being made while places that students need to be in, like cram schools, study rooms, and libraries, are being regulated.
Students also noted that many of them have to take a final exam in December this year, saying even if they do want to get eventually vaccinated, it's not a good timing for them. But also, let's take a listen to the expert and Education Minister Yoon-hae on their remarks regarding these latest issues.
It is inevitable that vaccine passes need to be implemented at places with a high concentration of cases. Data from analysis shows that schools and private academies are at the greatest risk when it comes to students and children.
We will hold discussions on whether it's possible to reflect the feedback and opinions we've received, and if there is any room to make improvements and tweaks.
You also mentioned that although these vaccine passes do urge citizens to get unvaccinated, there's still the option of handing in a negative PCR test result within 48 hours before entering such venues.
Right, that is a valid point. So if you choose not to get vaccinated, you have the option of handing in a negative PCR test. All right, so as always, thank you very much for the update.
My pleasure.
Britain and Canada will not be sending diplomatic delegations to the 2022 Winter Olympics in China. Their respective decisions follow the Biden administration's announcement earlier this week to boycott the event. Our Kim Hyo-san has details.
The UK and Canada have become the latest nations to announce a diplomatic boycott of the Beijing Winter Olympics, which kicks off in February.
And there will be effectively a diplomatic boycott of the Winter Olympics in Beijing. No ministers are expected to attend.
On Wednesday, British Prime Minister Boris Johnson explained the decision was made based on alleged human rights abuses in China, which the Chinese government strongly denies. Later in the day, Canada followed suit, again citing its human rights concerns.
As a country, indeed, as many partners around the world, we are extremely concerned by the repeated human rights violations by the Chinese government. That is why we are announcing today that we will not be sending any diplomatic representation to the Beijing Olympic or Paralympic Games this winter.
Trudeau said the country's boycott should not come as a surprise to China, as Canada has been clear for years about its deep concerns over human rights violations in China. Their decisions come a day after the White House confirmed the U.S. will stage a diplomatic boycott of the Games to protest China's human rights abuses. Washington's decision was endorsed by Australia, which made it clear that the country's athletes will still represent the country as they did proudly at the Tokyo Olympics. Other countries, including Japan, are also known to be mulling a diplomatic boycott. Despite the boycotts, the president of the International Olympic Committee, Thomas Bach, said he was pleased athletes will still take part. Kim Hyo-san, Arirang News.
Meanwhile, on the local front, curtains went down on the 2021 UN Peacekeeping Ministerial meeting this past Wednesday, with the host Korea pledging to promote related projects through technology. Our Yoon Jung-min reports.
The United Nations Major Peace and Security Forum, the 2021 UN Peacekeeping Ministerial, held for the first time in Asia, wrapped up its two-day virtual event in Seoul on Wednesday. High-level officials from 75 countries took to the podium, and of them, some 60 countries unveiled their pledges for contributions, including offering strategic assets. At this year's meeting, South Korea announced the Seoul Initiative to support the technological and medical capacity of UN peacekeeping operations. One of the pledges made includes building smart camps for peacekeeping operations, which combine IT and smart city technologies to build a network for peacekeeping troops and their facilities. The country will also offer 16 helicopters and send more medical units.
I look forward to the Seoul Initiative helping to ready our peacekeepers meet their goals and mandates to keep peace and protect vulnerable civilians on the ground.
Regarding South Korea's contributions for building the smart camp, UN Under-Secretary General Jean-Pierre Lacroix called it necessary during an interview with Arirang TV.
First of all, that we're extremely appreciative of the Republic of Korea's support to UN and to UN peacekeeping. We have a strategy to improve the use of digital technology in UN peacekeeping, and the Republic of Korea has pledged its support to that strategy, and the Smart Camp is an example of that.
At the meeting, a number of countries reaffirmed their support for Action for Peacekeeping and its follow-up Action for Peacekeeping Plus, while supporting the Seoul Initiative. The participants each announced their contributions to the peacekeeping operations, including offering more training, COVID-19 vaccines, or promoting the involvement of women. The U.S. ambassador to the UN, Linda Thomas-Greenfield, unveiled the U.S. pledges to contribute more to bolster airlift capacity, including funding for South Korea and Kenya to build a new helicopter unit. At the closing ceremony, Seoul's defense minister Seok hoped for lasting peace on the Korean peninsula, as well as peace and an end to conflict around the world. Former UN Secretary General Ban Ki-moon also delivered his speech during the session, stressing the importance of the PKO amid the pandemic, the climate crisis, and many other challenges. Yoon Jung-min, Arirang News.
Despite earlier forecasts about a further decline in prices of DRAM chips, new market findings show a slight rebound. Our Om Ji-young reports.
Memory chip DRAM prices in the spot market have been on the rise for 2 weeks, debunking a gloomy outlook. According to market tracker DRAM Exchange, the average contract price for 8GB DRAMs for PCs stood at around $3.3 on Tuesday. DRAM average prices have risen about 4% in the last 2 weeks from the lowest level of about $3.1 on November 22nd. The price was down roughly 40% to around $3.1 from this year's high of $5.3 in the middle of March. In recent months, the global memory chip industry faced downward pressure amid the COVID-19 inoculation drive picking up steam, leading to expectations for weaker demand. Also, recent system chip or non-memory chip supply shortages have been weakening demand for memory chips, leading to a decrease in DRAM prices. But market watchers say the outlook for the memory chip market may not be as bad as expected. Analysts at KB Securities said DRAM prices are set to be at their lowest in the first quarter of next year and expected to recover. Deutsche Bank also said that as companies are investing in the IT sector, demand for DRAMs is increasing and added that DRAM prices are expected to bottom out in the second quarter of next year before rebounding. Morgan Stanley said the demand for DRAMs for PCs is anticipated to grow, revising its expected drop in DRAM prices in the first quarter of next year from 10% to 7%. Analysts also say the spread of Omicron variant could further boost the demand for chips with the rising contact-free trend. Om Ji-young, Arirang News.
On the entertainment front, BTS's Butter continues to melt the hearts of many, with more acclaim this time at the People's Choice Awards. Our Kim Da-mi has more.
BTS has done it again, this time snatching 3 prizes at the 2021 People's Choice Awards. In Santa Monica on Tuesday local time, the K-pop superstars won a Group of 2021 and the awards for Song and Music Video of 2021 for its mega hit, Butter. The Group of 2021 award is particularly meaningful in that BTS beat other big global artists, including Coldplay, Dan and Shay, and Maroon 5. Thanking its fans, the boy band said through its agency Big Hit Music that the members are happy because the awards mean that their efforts are being recognized. Last year, BTS swept 4 titles, Group, Song, Album, and Music Video of the Year at the annual ceremony. In fact, the K-pop stars have been on a roll, becoming the first Asian act to take home the Artist of the Year award at this year's American Music Awards. Its second English-language song, Butter, has been particularly good to the group, staying atop the Billboard Hot 100 main singles chart for 10 straight weeks, and last week earned the accolade of Record of the Year by American entertainment magazine Variety. More good news for K-culture. Netflix's Squid Game bagged the binge-worthy show of 2021 award, beating 6 other shows including Loki, Ted Lasso, and The White Lotus. It's already the show's second international award after winning a 2021 Gotham Award just last month. The K-drama continues to prove its quality and popularity, being nominated in 3 categories at the Critics' Choice Awards selected by the Broadcast Film Critics Association. Kim Da-mi, Arirang News.
Now, here's some food for thought. Some experts are claiming creepy crawlies may be our next option for sound nutrition amid food shortages in the near future. Here's Chang Tae-yeon.
This is a farm, but not an ordinary one. It's an insect farm, which can actually save our planet. These clean insects being bred at this farm are for us. They'll be served on our plate. Because it takes less land, energy, and fewer resources to grow them, it will lead to less greenhouse gas emissions. The United Nations Food and Agriculture Organization has said that the world's population will grow to more than 9 billion by 2050. The report also says we will need up to 5 times more energy and 1.7 times more food. So, we need to figure out an eco-friendly way to mass-produce our dinners. To produce 1 kilogram of protein, livestock need to be fed 10 kilograms of food, while insects need just 1 kilogram. And insects often eat the byproducts of crops like rice, so we don't need to do extra farming to feed insects. According to data from the Agriculture Ministry, South Korea's insect industry had sales of some $35 million in 2020, and more than half of that came from edible insects. As of now, the ministry has allowed only 10 types of edible insects, including mealworms and beetle larvae. Authorities are closely inspecting the breeding farms and making sure that they follow safety guidelines.
The edible mealworms are grown in a clean environment, and I started this insect farm business because mealworms are a great source of protein, and if you don't have enough protein, your health will suffer.
They make sure that all the impurities are removed before drying the insects, so it can cost up to 100,000 won or some $85 per kilogram. And our crew met one of the master chefs specializing in insect foods, and she cooked us Korean pancakes and desserts. She ground up the mealworms and put them in the dough and used more bugs as a topping. It tastes savory, nutty, and earthy, if you know what I mean.
I often add insects when making a stew or seasoned side dish. When outside, I don't have time to have food, so I just eat dried insects. That's why my skin is so tight.
She cited medical sources that say bugs can actually help people recover from fatigue, as well as improve their blood flow and prevent diabetes. But you have to be careful if you're allergic to shellfish, or you could feel itchy or get a rash. Apart from that, there's no excuse not to tuck in. 장태현, 아리랑 뉴스 예천.
As part of proactive efforts to better contain the potential spread of Omicron, health authorities here are stepping up their COVID-19 testing campaign nationwide. For more, I have Chun Song-cho standing by. Song-cho, welcome. Song-cho, can you hear me?
Sunny.
Right. Song-cho, I see you are at a temporary screening center right now.
Yes, good afternoon. That's right. So I'm standing right outside the public health center at Yangcheongu district, where there's a makeshift testing site, COVID-19 testing site is located. Well, it's Thursday afternoon. It usually means a slow day for clinics and public health centers, but that's not the case these days. As you can see behind me, there's throngs of people behind me who turned up to get themselves tested even on a weekday. I mean, at an earlier point, there were as many as 200 to 300 people waiting in line. So it's apparent that people are on high alert over the country's virus situation these days because there is a growing threat of the new Omicron variant, and also we continue to see a big rise in the number of new daily cases these days. So we just learned that 7,102 more cases were added to the country's tally, and with 22 more people infected with Omicron. So higher demand for testing led to long wait times and lines at testing centers, prompting the health authorities to come up with various ways to speed up the process while ensuring the safety of everyone at the center. So, for instance, people now can fill up the registration form online, and also the social distancing and the mask mandate is enforced at all times as well. Now, if you're in South Korea, you have the benefit of having access to free testing at a public health center near you. So I want to show you how you can look it up on the internet to find out which center is the nearest to you in your neighborhood. So first, obviously, you have to go on the official website of the Ministry of Health and Welfare, and that is mohw.go.kr. And there's a tab where you can see the list of all the testing centers in operation. And if you write down the name of your town or the address, it will give you a selective list of centers that are closest to you with their locations and times of operation. Well, usually they operate 9 a.m. to 9 p.m. on weekdays and 9 a.m. to 6 p.m. during weekends, but you may want to check the time in advance because it may vary depending on the regions and centers. And also, another useful tip, if you want to save time, is to check the Smart Seoul map on the internet, because it is a map of Seoul indicating which centers are busy at the moment. So it will be very useful when you're trying to decide which centers to visit amongst the options that you have. Obviously, testing is the key to returning back to normal because it prevents you from developing severe symptoms if you have the virus, and also it prevents you from spreading the virus to other people. So even if you have no symptoms, but think or were told that you were in contact with a person with COVID-19, please get yourself tested right now, and let's help flatten the curve once again. This has been Chun Sung-cho reporting live from Yangcheongu District, and back to Sunny in the studio.
All right, Sung-cho, thank you very much for that essential information. And again, our sincere gratitude to all those at the front lines of the pandemic. December this year marks 1 year since the launch of our COVID-19 vaccines, and as of now, over 40% of the global population is reportedly inoculated against the pandemic. But the emergence of a new variant is casting uncertainty over the course of our fight, and health authorities are urging for booster shots to ensure greater protection. For more, I have Dr. David Kwak from Sooncheng University here in the studio. Dr. Kwak, it's a pleasure to see you again.
Good afternoon, Sunny.
I also have Dr. Alice Hyungyang at Ms. Medi Women's Hospital. It's a pleasure, Dr. Dan, seeing you online now.
Thank you for having me.
I also have Dr. Aruna Subramania at the Stanford University, that is, live on the line as well. It's a pleasure to have you with us, Dr. Subramanian.
Thank you for having me as well.
We'll start here in the studio then. Dr. Kwak, from the start of the inoculation campaign, the world has been plagued by vaccine inequality, and it continues to remain a challenge. Why?
Well, so it's easy to make an assessment that unequal sharing by the developed countries resulted in the inequity that is lacking in the vaccinations in the underdeveloped countries. I agree with the idea that many of the developed countries was quite reluctant to share the overloads of the vaccinations that they had at hand, especially through the huge waves that hit both the continents while we were persevering through more globally. But I also want to point out to the factor that when we were first hit with the pandemic, everybody did not know what to expect to foresee in the near future. So I kind of understand the reluctance that the developed countries to really share the overloading stocks at hand, because if another huge wave were to hit those countries, they had to have something quite ready for themselves as well. So I do not want to sort of finger point and blame a country for not sharing their vaccinations, but looking into the future, I guess in the future we would have to come up with a better method and accessibility so that we can actually minimize this inequity, especially when we are expecting also to add, let's say, oral regimen to come into the picture in the the near future. So for those, I think obviously with the oral pills, it will be much more accessible. So I think it'll be much easier to share with the rest of the world. But that being the case, I think also through for the vaccinations, we would also need to create more chances for these underdeveloped countries to gain access to those vaccinations as well.
Right, because at the moment, a lot of priority has been placed on national interests, right?
That's correct.
Dr. Kwok, the world has, well, not the world, but vaccine inequality, that is, has been blamed for the emergence of Omicron by the World Health Organization. What are your thoughts on this, Dr. Dan?
Well, you know, anywhere there is a person with active COVID-19, we can have a variant emerge. Of course, if there is a community or region that has more unvaccinated or non-immune people with high rates of transmission, that will increase the chance of a variant. Also, infection of people who are immunocompromised is thought to increase the chance of having a new variant with higher numbers of mutation. And I think certainly having unequal vaccine distribution is playing an important factor, but I think it's much more complicated than simply having this as the one issue. I think vaccine uptake is also a very important issue. For example, in the United States, they have ample supply of vaccine. However, their full vaccination rate remains at 60%. According to the WHO, the United States reported the highest number of new COVID cases in the world. So certainly the next variant of concern could possibly emerge from the United States, despite having a large supply of vaccines. Also, in Africa, they are seeing more and more vaccine supply arrive on the shores of Africa. However, according to a WHO representative in Africa, having opaque vaccine delivery plans is actually the #1 reason that's holding Africa back in terms of a vaccination drive over there. So it's not necessarily just a supply issue. The other issue is overall COVID management. Here in South Korea, we have one of the highest full vaccination rates in the world. And yet we are seeing record-breaking numbers of new COVID cases. Our new daily COVID cases per million population is actually higher than India, Brazil, Colombia, and Mexico. And so certainly here in Korea, we have selection pressure, we have high transmission rates, and we could see the next variant of concern emerge in South Korea. The other issue is genetic surveillance ability. So I think the reason why South Africa was able to detect the beta variant of concern, the Omicron variant of concern, is because they have excellent genetic surveillance capabilities. I'm actually more concerned about countries that do not have genetic surveillance capabilities, low vaccination rates, and low rates of immunity. I mean, a variant could emerge in such an environment, multiply for weeks before being distributed around the world or distributed to another country where they do finally detect this new variant. So it's not just a matter of unequal vaccine distribution. There are many other, I think, factors that are at play that will determine where the next variant of concern emerges from.
Right, a very complex issue, of course. Meanwhile, Dr. Subramanian, according to White House Chief Medical Advisor Dr. Anthony Fauci, Omicron is, and I quote, almost certainly not more severe than Delta. Do you agree?
I do agree with what we know so far. You know, so far when we look at the countries where they have higher rates of Omicron, like South Africa itself, the physicians there are reporting patients with less severe disease, more milder symptoms, fewer people on oxygen, lower rates of hospitalization than they ever saw with previous waves. So this is all very, very reassuring. And so far in other countries as well, they're reporting milder cases from Omicron. So far, that's what it does look like. The reason we need to think
a little bit and make sure of this and watch for a little while. Of course, the first people to get infected in South Africa were younger, healthier people. Some of them had already been infected previously, so they had some pre-existing immunity. And so there were many reasons they could have had milder disease. You would expect them to have milder disease. And we really have yet to see how the disease is going to behave in older people, in unvaccinated, large numbers of unvaccinated, older, higher risk people. But hopefully we're getting enough vaccine rollout around the world that that shouldn't be as much of a problem. And the other reason to watch and wait is that, as you know, there's always a lag between cases and then developing severe cases, hospitalization, and then a lag for deaths. So right now we're seeing the spread of Omicron, and we know it's very contagious, but we don't have all the information yet.
Right. And against the concerns brought up by Dr. Subramanian, Dr. Kwak, there are concerns of Omicron's potential rapid transmission. And this has been raised because of early reports in Hong Kong about the variant spreading across the hallway of a hotel. Having said that, how do you respond to fears of Omicron's airborne risks?
Well, it's not just the report that came out of Hong Kong that shows us a brief picture of how much higher transmissibility that Omicron could cause. But also we had our own case where a person who were wearing masks, who were acquainted just for about a minute or so, still got infected from another person who was carrying Omicron at the time. Throughout the different cases that are reporting worldwide, I think we're seeing clear, much higher transmissibility. I think it was WHO who made a statement just yesterday or at least a couple of days before that the R0 value of this Omicron variant could possibly exceed that of 2.0, which is far beyond anything that we've had in the past variants with 1.2, 1.3 that we had in Korea. So I think it is becoming rather more clear that it is definitely more transmissible. As Dr. Subramanian also mentioned, that we still have to see and observe what sort of severity and what kind of mortality Omicron still could cause when it spreads so much farther. We've had only numerous cases so far in the country that we were able to trace back to. I personally believe that there would also be domestic cases that are already happening with Omicron, but we haven't really had much time to observe what exactly clinically these Omicron variants could cause. So we'd have to have at least a little more time to really assess how dangerous Omicron is in addition to the transmissibility it already has shown to have.
Right. Dr. Dan, how do you explain the relatively high rate of reinfection caused by Omicron as reported by experts in South Africa?
Well, I think it has first to do with the high rate of infection that was prevalent in South Africa. So seroprevalence studies, in other words, looking at how many people in the communities had antibodies to the SARS-CoV-2 virus. Seroprevalence rates were as high as 60 to 80% in some communities. So they have this background level of immunity or previous infections in that country. The second has to do with, I think, the immune escape properties of the Omicron variant. The Omicron variant has the highest number of new mutations of any variant of concern so far. And so it's just leading to a lot of immune escape. And then also, South Africa has a fairly low full vaccination rate, around 30% or so. And so I think it's the combination of those three factors that are leading to higher rates of reinfection with the Omicron variant compared to other variants of concern.
Right. Now, on a very slightly bright note, as my colleague Yeon mentioned earlier, Dr. Kwak, an early study by Pfizer that was shared Monday morning shows a third dose of its vaccine is effective against Omicron. How do you assess these findings?
Right. So from the two different reports regarding Pfizer's efficacy against the Omicron variant, a report said that only with the completion of 2-dose vaccinations with Pfizer, it created about a 40th of the neutralizing antibody that it used to make against any other variants. But with the third booster shot, they also said that it boosts about 25-folds of the antibodies they created before. So it's plus and minus combined. So it definitely, vaccinations, it still protects us against either from getting infected with any of the variants, and also it protects us from going into more severe progress of the disease. So vaccination is more of a necessity in any cases. So whether that be from booster shots or whether that be for the first shots they ever get, if they haven't been vaccinated yet, it'll still give us some sort of protection. Now, getting into more scientific details, so the Omicron variant is creating this evasion because it's formed slightly different, morphologically speaking, from the prior variants or the original variant of the SARS-CoV-2 virus. Now, it's the antibodies that are supposed to be formulated by injecting people with these vaccines still do formulate these antibodies that can somewhat attach to whatever the variants might be. So there's that overlapping of the morphological chain and key sorts of matching system. So even if it gets weaker, it does not mean it's obsolete. It does not mean it creates no protection. It'll still provide at least some level of protection. That's why vaccination still remains one most necessary method to really fight against the virus.
Right. Dr. Subramanian, vaccine makers are currently working around the clock to modify their vaccines to better target Omicron. What are your thoughts on these modification efforts?
Yeah, so all the companies, many companies have already said that Pfizer, Moderna, J&J, and Novavax, they're all trying to come up with Omicron-specific boosters, and they say they'll be ready in 100 days by March. And all of that is well and good. I think we should be prepared. We don't know enough about what the outcomes are going to be with Omicron as it spreads. But as Dr. Kwok said, you know, it's not that our current vaccines or the boosters aren't going to give us protection. So these still might be very protective in the real world. We can't always know how things are going to turn out in real life when you look at lab studies. So I think, you know, we really need to wait and see. And people, as he said, do need to get vaccinated, need to get boosted. And yes, it's good that they're working on new formulations, but then as these new variants come up, they may come up quite frequently. They seem to be coming up quite rapidly. So how often are we going to need new boosters? And hopefully we can rely on some of the vaccines we already have to provide enough protection for us.
Right. And speaking about boosters, Dr. Dan, do tell us a bit more about the efficacy of booster shots as health authorities across the world seek to encourage members of their public to get it, a third dose that is.
Right. So there is a the COMV boost trial was conducted looking at the reactogenicity and immunogenicity of 7 different vaccines used as a boost after a primary series of either AstraZeneca or Pfizer. So 2 doses of AstraZeneca or 2 doses of Pfizer, followed by a third dose or a boost of 7 different vaccines. And the only booster that did not achieve predefined criteria for minimum clinically important difference was Valneva, which is not used in Korea yet. But and when Valneva was used after a primary series of 2 doses of Pfizer, that was the only combination that did not show favorable results. Otherwise, the 6 other vaccines investigated, and they are AstraZeneca, CureVac, Janssen, Moderna, Novavax, and Pfizer, they all showed acceptable levels of reactogenicity. In other words, side effect profiles were acceptable, and favorable immunogenicity. In other words, antibody levels and T-cell responses favored the use of a third dose booster with any of these 6 other vaccines compared to placebo. And so what this gives is it gives governments, I think, flexibility and confidence in knowing that boosters will work in elevating immunogenicity, so immune levels in their population, and flexibility. Basically, we don't have to be assigned to one particular booster vaccine. Any of the 6 vaccines that were studied showed good results.
Right. Dr. Subramanian, keeping in mind what Dr. Dan has just said, where do you stand now on the debate over patent waivers for vaccines?
That's a great question. I mean, I do think worldwide vaccine equity is so important, as both of them said. There are many factors here, but, you know, especially back in May, I really did think that we should be having, you know, patent waivers, because we do need to allow for the production of generic versions and for the whole world to be vaccinated. It really feels bad when first responders, frontline workers in Africa and other places aren't getting protection, and you know, we're getting boosters. So I know there are many factors at play here, but we really need to look at what's good for the international community and for health worldwide more than profits. So my personal feeling is in support of these patent waivers, and I think that you know, we need to have more global cooperation to really to understand what's happening in one part of the world affects people all over the world, and you know, we can't really just think about ourselves in our own country.
Right,
anymore.
We can't. That is true. And finally, one final question to you, Dr. Kwak. Let's go back to the topic of boosters. What has been disclosed thus far about the post-inoculation reactions to booster shots?
Well, I can give quite a simple answer to that. Nothing much. So it is not not anything different from what we had when we were completing our original schedules of vaccines. That is, we had some muscle pains. Some of them had a couple days of fever. Some of them had headaches. But nothing other than that, nothing happened. And really, booster shots has distinguished itself from the original schedules of vaccines. So if anyone is planning to receive the booster shots in the near future, they should not worry, because it's nothing new that they're going to get with the booster shot, only if it's milder. So I received mine a couple of weeks ago. I didn't feel anything.
I see. Well, that is good to know. All right, Dr. Kwak, as always, thank you very much for your thoughts.
Thank you.
Dr. Dan, thank you for your time and your words. And Dr. Subramanian over in the US, thank you very much for your insights.
My pleasure.
Right, well, as emphasized by health experts time and time again, prevention is better than cure. So do seek to abide by prevention guidelines and to get a booster dose if possible. Thank you for watching.
지겨운가요? 힘든가요? 숨이 끝까지 찼나요? 모두가 최선을 다하고 있는 이 힘든 시기에도 분명 끝은 있을 테니까.